Now we're going to hear from Dr. Cara Renzelli, the Clinical Director of Substance Abuse Services and Behavioral Health Integration at UPMC Health Plan. UPMC, UPMC Community Care. We have, they all have shown so much vision and support from the very beginning of the Pittsburgh Recovery Walk, and it started way back in 2016, and they continue to support it. Dr. Renzelli has 10 years of research experience and 15 years in leadership roles in research, clinical training, and also the business operations at Western Pennsylvania-based treatment providers for substance use disorders. It's important that we acknowledge our system of care and the work that various people do within that system. Without some of the science and research that have been done in the area of addiction and addiction disorders, we would be floundering in many ways. And I think it's been helpful, and I've learned over the years that there's a combination of science, intuition, art, and intuition, and spiritual support that makes recovery possible. Dr. Renzelli's interested are in implementing and sustaining science-based treatments, overdose awareness and prevention, and population health management. So now I'd like to turn it over to Dr. Renzelli to share a message of support.
Thank you, Alex. I'm proud to be representing UPMC and UPMC Health Plan at this year's Pittsburgh Recovery Walk. We are pleased to be premier sponsors of this event. As a healthcare system, we recognize that substance use disorders are a chronic, treatable condition from which people can recover. Like any chronic condition, people with this disorder need treatment and support to achieve and manage their recovery. Over the past 15 years, new insights about the brain's biochemistry have led to safe and effective medications and better behavioral therapies for substance use disorders. Unfortunately, the stigma surrounding these disorders prevents many people from seeking the treatment they need. At UPMC, we take our role in helping individuals and their families on the path to recovery very seriously. We are committed to providing unbiased information about prevention, treatment, and recovery that is timely and evidence-based to individuals and their families. We also recognize that every recovery path is unique. The values, goals, and perspectives of individuals and their families differ. There is no one-size-fits-all approach to treatment and recovery. That's why National Recovery Month and related events like this walk are so important. By bringing people together and sharing success stories, we can reduce the stigma and spread the message that recovery is possible. Today's event highlights the contributions of so many people committed to helping others and the courage of the individuals and their families who have embarked on their recovery journey. It's truly inspiring, and I'm honored to be a part of this celebration of recovery. I'd like to thank everyone who is participating in the Recovery Walk and thank the Institute for Research, Education, and Training in Addictions for making it possible for us to stay connected and celebrate this year's Recovery Month.